In this paper, we explored one of the most pressing challenges in healthcare today, the administrative burden associated with the electronic health record. Today, nearly a quarter of clinicians' working hours are consumed by non-clinical administrative tasks, and this contributes to burnout, inefficiencies, and compromised care experiences for both providers and patients. The key takeaway from this article is that addressing administrative burden is not just about efficiency, but rather restoring purpose and joy for our clinicians in how they're practicing medicine. My name is Meghna Kuverji. I am an administrator at Mayo Clinic, serving in a role for enterprise clinical innovation. The Reimagining Electronic Health Record to Reduce Administrative Burden article will be appearing in the August 2025 issue of Mayo Clinic Proceedings. At Mayo Clinic, very early on, we recognized the growing strain placed on our clinicians, especially around documentation, in-basket management, and order workflows. We strategically implemented intelligent assistance, artificial intelligence, and process improvements at scale to help reduce some of this burden. This work not only enhanced the daily experience of our providers, but also allowed them to focus more fully on what mattered the most to them, which was delivering hope and healing to our patients. What makes this effort unique was its structure. We leveraged a multidisciplinary governance, physician administrative dyad leadership, and an iterative nimble approach to piloting both internal and external solutions. In less than a year, we were able to achieve measurable improvements in time savings, workflow efficiency, and cognitive burden reduction. Some of these results included 2 million clicks eliminated, 8.3% average time saved to our nursing teams, 60% reduction in clerical burden from order optimization workflows, and over 7% reduction in time spent charting. Ultimately, this initiative affirmed the power of involving frontline staff in the design and delivery of solutions and showcased how collaborative, user-centric innovation can meaningfully improve delivery of care. The learnings from this work will not only shape Mayo Clinic's future digital health strategy, but can also serve as a roadmap for many other health systems that are seeking to alleviate administrative burden. This also allows them to rehumanize the practice of medicine. For patients, these efforts translate to a more meaningful time with their providers. The reduction of administrative burden, whether it's less time spent on documentation or fewer after-hours tasks, we're giving clinicians the ability to be more present, engaged, and focused during patient care activity. This not only improves the quality of care they're providing, but also enhances the overall patient experience. When our providers are less burnt out, they are more connected to their purpose, and our patients feel it. And ultimately, that leads to better outcomes, stronger relationships, and a human-centered healthcare experience. Our next step in this effort is to keep identifying high-impact, high-value solutions for healthcare providers, because the need to alleviate administrative burden is only growing. Across the industry, there's exciting momentum around automation, AI, generative AI, and other digital tools. But as we look to scale these solutions, it's critical that we don't unintentionally create more burden. We need to focus on measuring real outcomes, solving for real problems, working in an agile way, sharing what's working, and scaling thoughtfully. By doing this, we can ensure that innovations don't just exist in isolated pockets, but are integrated in a seamless way that sustainably supports clinicians and strengthens patient care. Please take some time to read our article, which will appear in the August 2025 issue of Mayo Clinic Proceedings for further details. Thank you.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research. published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.